Good day and welcome to Health Matters with Quincy. My name is Quincy and you're welcome. So, first off, thank you to my amazing subscribers. I love you all. God bless you all for me. And if you're joining for the very first time, you're welcome. This is Health Matters with Quincy. Please don't forget to subscribe and like the video and stay tuned for many more interesting and wonderful videos on this channel. So today we're going to talk about something very interesting and also very educative. We're going to talk about STIs, sexually transmitted infections. But today we'll be talking about HPV, that is human papilloma virus. A lot of us might be hearing about HPV, but we don't know the full meaning or we don't know the meaning. The full meaning of HPV is human papilloma virus. Take note, and it's a virus, obviously, from its name, human papilloma virus. So my objectives under this HPV will be definition, types, the signs and symptoms, the risk factors, how it can be transmitted, the diagnosis, the treatment, prevention, and complications. I think there are nine a number. nine, nine a number, yes. So first off, human papilloma virus. For this video, we're calling it HPV, please. So HPV can be defined as sexually transmitted infection that can lead to cervical, vaginal, anal, mouth, and throat cancer. HPV has a lot of strands, about 150 strands of HPV, but HPV 16 and 18 has been known to lead to precancerous changes. That is, HPV 16 and 18 has been known to lead to cancer. Some precancerous changes we can see include dysplasia, that is abnormal growth of cells in the part which is affecting. Yes, so second, which is types of HPV, we have the skin wart, we have the genital wart or mucosal wart, and then we have the low risk HPV and then the high risk HPV. Skin warts affect the skin surfaces, and people with HIV are at very high risk of having skin warts. And then we have genital warts, which is also called mucosal warts. This affects the genital area, which is the anus, the vagina, the cervix, and also the mucosal lining of some areas of our body. And then low risk HPV. Low risk HPV also affects the genital area, but one peculiar thing about it is that it's asymptomatic. It doesn't come with any symptom at all. No discomfort, no pain. The individual does not feel anything. And then we have high risk HPV. High risk HPV also affect the genital area and the oropharyngeal area, which is the mouth, the nose, the ear, and the throat. It affects these areas, but one peculiar thing about it too is that it leads to cancer. Yes, high risk, from its name only, you know it leads to something very alarming or threatening. Yet, yes, it leads to cancer. So signs and symptoms of HPV. We have skin warts, which is flat or protruding growth on the skin surfaces. Then we have genital warts, which is also flat or protruding growth on the genital area, that is on the cervix, on the vagina, on the anus, yes, on the penis or any part of our genital area. Yes, so we also have abnormal vaginal and penile bleeding, abnormal vaginal and penile discharge. We have discomfort, we have burning sensation while urinating, we have sore throat for when it's affecting the throat area, we have lump in the neck, we have itchiness, there are a lot of things. Most times the person feels a burning sensation while urinating, and then there is also pain during sexual intercourse. Yes, pain during sexual intercourse. Take note of this too. So when you begin to experience or see any of these symptoms, please meet your doctor. Then we'll move over to the how it can be transmitted. One, it can be transmitted to skin contact. Yes, with one who has it. It can be transmitted through sexual intercourse. Yes, it can also be transmitted through oral or anal sex. Yes. So move over to the risk factors of HPV. Having so many sexual partners, yes, having so many sexual partners put you at risk for it. Not using condom while having sex, yes, and then having sexual intercourse with one who has HPV, yes, having sexual intercourse or having anything to do with one who has HPV, skin to skin contact too with one can also put you at risk of it. And then being HIV positive has made you one, that is, once you're HIV positive, you're at high risk of having HPV. So moving over to the diagnosis, it can be diagnosed through physical examination. When you go to the hospital, your doctor or the medical practitioner there can run some observation on you, an inspection. He can check out for if there are growth. Like I said, the skin white, he will check out for skin white and genital white on your skin surfaces and also on your genital areas. And then he also check for any, like I said earlier, some signs and symptoms: abnormal vaginal bleeding, abnormal penis bleeding. Yes, he checks for this. So the doctor checks for all this, or the nurse checks for all this. And then we also have HPV tests. Yes, when you go to the hospital or the clinic, you ask them, you tell them that you want to run HPV test and to do it for you. If that particular clinic can't do it, they refer you to a bigger place where you can do it and carry out your test results. Once you know your status concerning HPV, then you know how to handle it. If you don't have it, you're okay. But if you have it, you start running around to treat yourself, because if left untreated, can lead to something more dangerous and more life-threatening. So we'll move over to the prevention. The prevention actually is reduce your sexual partners, yes, and be faithful to your partner, yes. And then we also have use of condom while having sex, yes, use of condom while having sex. And then taking the HPV vaccination. Yes, HPV has a vaccination. Taking the HPV vaccination will help prevent the virus HPV, that is human papilloma virus. Then we also have the treatment. It can be surgically removed. Yes, surgically removed. Those skin whites, those growths can be surgically removed. And then we also have cryotherapy, that is freezing this whites on the body, on the genital area, or on the skin. You can freeze them, cryotherapy, yes. And then we also have what we call topical medication. Topical medication is more like a cream your doctor or nurse or medical provider, healthcare provider recommends or prescribes for you to apply on your body, on the skin surfaces, which affects on the genital area. Yes, there are creams which are for the skin, and there's also some creams which are for the genital area. Yes, there's some creams that are not rubbed on that can be used on the skin but cannot be used in our genitals. Please make sure you listen to your doctor carefully when he tells you what to do concerning this. And then complication. One major complication of HPV is leads to cancer. If left untreated, can lead to cancer of the parts which it affects. A lot of youth below the age of 30, most people are suffering from vocal cord cancer, and it's as a result of untreated HPV. In most cases, I'm not saying in all cases, but in most cases. So we have come to the end of today's topic, or should I say today's show or episode, anything you want to call it. But thank you all for watching it to this point. Thank you all for watching this video. And if you have any question, please drop it on the comment section. I will do my possible best to answer to the best of my knowledge. Yes, to the best of my knowledge. And please don't forget to subscribe and like this video. Thank you for watching. This is Health Matters with Quincy. Bye.